Hey guys, welcome back for our daily practice questions. As always, I like to get into my intro and disclaimer before we get into the questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, courses, videos, and tools to assist nurses as well as nurse practitioners with being successful on boards as well as in practice. I have been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success, with a pass rate on our full courses of 99% and 100% pass rate on our one-on-one sessions. So I would like to work with you guys as well if you're looking for any resources or tools, but continue to do the daily practice questions as this will help you to repetitively apply the knowledge that you have and see areas that you may need to review for further retention and understanding. Before I get into question number one, I always like to give my disclaimer to you guys that there's no absolutes in medicines. We treat on a patient by patient basis, and any of these questions that I provide are based on the guidelines that are currently being tested on the ANCC as well as the AANP. If I am teaching on things that we do in practice, I will say that so there's no confusion, okay? All right, so question number one for today. A patient presents to the office for review of her DEXA scan results today. The nurse practitioner states that her results show a T score of negative 3.2. The nurse practitioner is explaining the score and diagnosing the patient. What is an appropriate diagnosis based on the patient's DEXA results? Is it A, normal healthy bone density, B, osteoporosis, C, osteopenia, or D, the test needs to be repeated? Take a moment and tell me what you got in the comments. All right, you guys, I always recommend reading the stem of the question first so that it slows you down and ensures that you are answering what is even being asked. So here, the stem of the question states, what is an appropriate diagnosis based on the patient's DEXA results? So the DEXA scan results, the T-score was a negative 3.2. So this is knowledge-based, understanding those DEXA T-scores and what those ranges qualify for our diagnoses, right? So here you should think B, osteoporosis, okay? Because we know it's not normal. Normal will be in the positive, um, like one and up and greater. Um, Osteoporosis, is negative 2.5 and lower. And I like to show the picture when I am teaching this in my classes, just simply because when you think of negatives, sometimes when you're saying lower, numerically you start to think of numbers, but remember the number, it'll be like here, like -3, -4, because even though we're saying lower, remember it's a negative, so the number numerically may be higher. But with the negative, it's lower. You get what I'm saying? And then osteopenia is anywhere from -1 to -2.5, okay? And the test doesn't need to be repeated. So again, because I gave a long spiel, osteopenia is -1 to -2.5, and osteoporosis is -2.5 and lower, okay? So here, the answer is B, osteoporosis. All right, question number two. The nurse practitioner is examining a patient with a diagnosis of syphilis. She notes a canker sore. I'm sorry, I always mess this word up. She notes a canker sore on exam. What stage of syphilis should the nurse practitioner diagnose? So, the nurse practitioner is examining a patient with a diagnosis of syphilis. She notes a canker sore on exam. What stage of syphilis should the nurse practitioner document? Is it A, primary, B, secondary, C, tertiary, or D, unable to stage? Take a moment and tell me what you got in the comments. All right, you guys. So, stem of the question states, what stage of syphilis should the nurse practitioner document? Right? All right. So, what should we document? So, in your stages, the canker sores are primary. That's the primary stage. Secondary are the rashes on the palms and soles of the feet. And then you get to your neuro in the final stages, okay? So the answer, because we see a canker sore, we know it's primary for syphilis as a primary presentation. And lastly, question number 3. A mother brings her 18-month-old into the office today with complaints of a runny nose, fever, and a rash that has spread from her daughter's face and is now on her chest. The nurse practitioner assesses the patient and notes a macular rash to the face and trunk with a temperature of 101.6. Based on these findings, how should the nurse practitioner diagnose? Is it A, roseola, B, rubeola, C, rubella, or D, Kawasaki disease? Take a moment and tell me what you got in the comments. All right, you guys. So, similar question states: based on these findings, how should the nurse practitioner diagnose? Okay, you know the routine. If it says diagnose, we got to run it back and see what the assessment is, right? What was the presentation of the patient? What are those subjective findings? What are the objective findings? What did the nurse practitioner observe or see on her assessment, right? So the subjective of our assessment, the mother brings in her 18-month-old, says that her daughter has had a runny nose, a fever, notices a rash that has spread from her face, now it's on her chest. The nurse practitioner is doing an assessment and she notes a macular rash on the face and trunk, and the baby has a fever, right? So you need to think to yourself, and I know that it is just so much rubeola, roseola, rubella, all the things that it can get confusing, and a lot of them present similarly. So I like to do these things to slow you down so that you're able to differentiate and figure out one versus the other. So runny nose, fever, rash. All right. So those things are very common. Rubeola, rubella, but you need to think of the key identifiers. This one, the rash spread from her face to her chest. That is a key identifier of rubella. Rubella has a macular rash that starts from the face and spreads down to the trunk, right? And I always say, Brittany's brilliance on how to remember that. Think of an old school bell, the bells that you take at the top and you shake and ring it. It's smaller at the top and then it gets wider at the base of the bell, right? So thinking of rubella and how it spreads, the top that you're shaking and ringing is the face, and then it spreads down to the wider part, the trunk, which is the bell, okay? The base of the bell. Make sense? I hope it does. In my brain, it does. But yes, rubella spreads. The key identifier is that it spreads from the face to the trunk. They will have a runny nose. They will have the fever. Remember, in roseola, they have the high fever and then they're better for a while. And then, bam, they show up with a macular rash. That's their key identifier. Rubeola, remembering rubeola is measles, but they have that blotchy rash with the couplet spots. Now, they do present with that runny nose and fever, but that's where they differentiate from rubella. They have the blotchy rash and couplet spots, whereas rubella has a macular rash that starts from the face to the trunk. Bell shape, face to trunk, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But you make sure to meet me back here. If you need any of our resources or tools, or would like to schedule a one-on-one session to help you with your weaknesses to make them your strengths, or a custom package to help you go from unsuccessful to successful, reach out to the nursing studio. You can give us a call at 803-400-6864, or shoot us an email at thenursingstudio1@gmail.com. I've also added links to our website as well as our ebook or paperback book in the bio for ease of access. But as always, happy studying. Bye, y'all.